Fitzroy Foot and Ankle Clinic. We see a lot of runners in our clinic with running related injuries, and luckily for us we have an excellent podiatrist who works here as well, Sophie Ryan. Sophie is a marathon runner herself. She's just come back from Nagoya in Japan where she's run a PB, and we're going to be talking with Sophie to find out how she manages runners who come in with running related foot pain. Sophie, if a runner comes into you and they have running related foot pain, what sort of questions I guess do you focus in on when you're taking a history from those patients?
Yeah, absolutely. Taking a history from a runner or a person presenting with a running related injury is not a whole lot different to an ordinary history taking, but it's very important to establish a key baseline understanding of where that person is at with their running, so how long they've been running for, and what their training looks like. So that would be like a typical training week, and also a training week in preparation for whatever they're preparing for. It's great to understand the surfaces that they run on, the frequency of their training, what sort of volume they're doing. You must understand the footwear that they run in, what they traditionally have been training in, and what they might be experimenting with, for example, and just get an understanding of what sort of injuries they may have had in the past, if they've struggled with injuries for a while, and also certainly understand where they want to go with their running, what are they training for, and what their goals are.
Yeah, great. Okay, so when you have you finished your history, and when you're going to then assess that patient with a running related injury, what sort of assessments might you do that are a little bit different to, say, someone who's coming in with a non-running related injury?
Yeah, absolutely. So a biomechanical assessment is certainly how the person walks, how they're standing in a weight-bearing position, and certainly how they walk. But it's really important to watch them run, and that's critical. You may watch them on land, it might be up and down in a straight line, or on a treadmill, depending on what the clinical setup is like. But watching them run for a good few minutes or a little while, great if you can get outside and watch that person run, especially to the point that they start to fatigue, because when they fatigue, weaknesses can be more easily identified, and you can actually see how their mechanics change when they are in a fatigued state, and that can certainly amplify where their injuries are occurring. But critical that you actually are watching them running for a good period.
And do you use any video analysis software at all when you're doing your gait analysis?
Me personally, I don't. I use just the good old naked eye. Yeah. A lot can be seen in a straight line, watching someone walk and run, and I work with someone for a period of time that allows me to get a really good grasp of what's going on. Yeah. There's some great software out there and it can be helpful, but I can always get the amount of information that I want and need to work with just from watching them with my own eye.
And in terms of like special biomechanical tests, is there anything that you'd be doing differently to a non-running related injury?
In terms of the actual walking and running aspect, there are no specific tests that I would do. I do like to watch people in a single leg squat position, just to get an idea of what's going on around their hips and their pelvis, particularly around their glutes. But quite often I'll use that same test on non-runners, but it's something that I'll really hone in on with a running patient.
Okay, great. So if you decide that your patient will benefit from some foot orthoses, what are some of the key considerations that you would make when you're prescribing an orthotic for a runner compared to a non-runner?
Yeah. There are two main considerations when you're prescribing an orthotic to a runner compared with someone who doesn't run. And the first main consideration is that the forces going through the orthotic are considerably different to somebody who is running with the device or not running with it. When we run, it's 4 to 8 times our body weight through our foot with every step, and the orthotic needs to be able to withstand that. So considering the materials that the orthotic will be made of is really important to ensure that the forces can be met. The other major thing is that the environment that the orthotic is inside someone's shoe when they're running, is quite different to the environment that an orthotic is in when someone's not running. So increased perspiration, a shoe getting wet, being out in the elements. It's very easy for a runner whose orthotic is in their shoes to wear out more easily. And it's important that the top cover and the orthotic is made of a material that will be very durable and ensure that the person has the orthotic for a while without it wearing out too quickly.
Do you ever prescribe different foot orthoses? So perhaps you'd have one for, say, day-to-day use and one when the patient is running?
That's a good question, and it's very much comes down to the individual. Most of the time, one pair of orthotics is fine for the person to use in their runners when they're running and transfer to their ordinary shoes from day to day. Some people prefer to keep them separate for that reason that I mentioned before in terms of perspiration and them getting wet, but it's up to the individual. In most cases, one pair of orthotics is fine and can be transferred.
Well, that is fantastic, Sophie. Thank you very much for sharing some of your thoughts with us on how to manage runners specifically related to foot orthoses who have some running related pain.
Thanks, Glenn.